Welcome back. We want to talk now about a problem doctors estimate affects at least 1 in 10 newborns, and that's oddly shapen, misshaped, and even deformedly shaped ears. In the past, surgery was the only answer if you wanted to cosmetically correct the ear's uniform appearance. But in the last few years, a non-surgical alternative has been developed, and it's getting some good results for a growing number of families. Who's older?
Liam. By 1 minute.
Suzanne and Michael Faith couldn't be happier about the new look of their twins, Liam on the right and Gavin on the left, especially since right after their birth, the Floral Park couple became alarmed after realizing each of the nearly identical twins had a noticeably misshaped ear. Then they noticed this brochure lying atop a nurse's station.
I feel it was divine intervention because we literally saw this pamphlet for ear molding, and Michael and I had been, questioning, is this ear a little off and what should we do about it?
In hospital rooms across the country, ear molding has emerged as an alternative to surgery's risk of scarring and longer recovery time.
It's really changed the way I practice ear reconstruction.
Dr. Nicholas Bastidas says in just the last 3 years, he's placed ear molds in more than 150 newborns and seen successful results for 80 to 90% of the infants.
I've had great success now in kids as old as 9 months.
Results are best if done shortly after birth. Specially fitted ear molds snap right over the ear. They're then held on by silicone clips as the child wears them for 3 to 4 weeks. For the twins' dad, avoiding surgery was a no-brainer.
There was really no risk involved, and insurance covered it, so we definitely went forward with it.
The family celebrated the twins' 3-month birthday with a little bit of cake, feeling good that their newly molded ears will head off what could have been problems growing up.
I thought if we can prevent possible future teasing or the boys being insecure about a physical trait of theirs, it seemed like the best thing to do for them.
And the Faiths say other parents should now be all ears in considering this non-surgical method.
And doctors add the procedure does not affect a child's hearing. Joining us now is the surgeon you just saw featured in our story, Dr. Nicholas Bastidas, a pediatric plastic surgeon at Cohen Children's Medical Center in New Hyde Park. Welcome to the show, doctor.
Thank you very much, Richard.
So you say this has changed the way you practice your ear reconstruction practice. Explain that.
Absolutely. So, traditional methods were waiting until the child was, around kindergarten age, around 5 or 6, and then taking the child for surgery to correct the ear deformity, which would require general anesthesia, recovery time and healing, and obviously expense, since that's considered cosmetic. But
how long would the recovery time with surgery be compared to the ear mold?
Typically about 1 to 2 weeks, and ear molding is obviously there's no recovery, there's no incisions, and no scarring.
No scarring would be a big one for a lot of people, because with a lot of surgery, no matter how good the surgeon is, there's still some noticeable scar left behind.
Correct. Absolutely true.
Yeah, so that's going to be popular with parents because they're going to be worried about their kids getting teased. And, getting teased is a big factor in people choosing to do this, right?
That's correct. So typically kids don't notice other abnormalities until around the age of kindergarten, 5 or 6, and that's when they get teased and they come home and parents sort of feel like they have to do something for them. Now this is an option where they can do something for them before it even becomes a problem, it even gets noticed and has any effect on their psyche.
Yeah, amazingly, even the parents feel guilty. They're just like, wow, I got to take care of my child, and, he came from me. This child, girl or boy, came from me, and whatever they have, they kind of almost adopt that problem personally for themselves, right?
Absolutely. I mean, once the child's first born, you're just so happy that your baby's healthy that a lot of times these things are overlooked, and it doesn't become a problem until it's a problem. But recognizing these things early, noting that there are abilities to treat it, it seems like a no-brainer to take care of this prior to this development.
So you say you've had 150 cases. Does that mean people are turning to this procedure instead of surgery now in big numbers?
Absolutely. This has replaced my need to do the traditional otoplasty surgery, which is ear pinning or ear reshaping using cartilage grafts or incisions and sutures.
Well, are there any risks at all with this? Say an infection from the ear mold because you got to wear it for a while, or maybe even in the end when you take it off, the appearance is worse?
I've never seen worse. Probably the biggest risk is sometimes it's undercorrected and may need additional molding or suboptimal molding. And the biggest issue with that is just the presentation. Usually the patients present too late, and therefore it's not as effective a treatment.
Now, it's best if they do it within weeks after birth. Does it become less effective as the child gets older, and is there a limit on how old the child can be to do this?
Absolutely. We believe it's due to the effect of the estrogen from mom that's still circulating in the blood, so therefore there is a time limit, and the ideal sweet spot is within that 3 to 4 week range of life. However, it is still possible older. It just requires longer molding, and it's often not as effective.
Well, you heard the father there say that it was covered by the insurance. Is that typically the case? Is it being covered by most insurance now?
Absolutely. Most insurances are recognizing this as a condition congenital problem, and therefore, given the fact that there is this non-surgical alternative method, they're opting to cover this.
Well, I would imagine there got to be cases that still require surgery where this would not help, though. Is that correct?
Absolutely. So typically, if you have a microtia, which is a small or malformed ear, those do require surgery. That's different than this, which is considered deformation or misshapen ear.
Well, you know, everybody will talk about some unique characteristic of them that they've had since birth, and not everyone has exact facial symmetry. So is this really right for everyone if you have just a slight irregularity?
It depends on the person, obviously. You know, things that are small to some people affect their lives greatly. I've even seen adults saying, even just with a little bit of a folded ear, that they've always been embarrassed about their ear. They wear their hair a certain style because of it, and this is a way to prevent that.
Yeah, it's amazing the way we like to compensate for anything we don't like about ourselves. Dr. Nicholas Bastidas, pediatric plastic surgeon at Cohen Children's Medical Center in New Hyde Park. Thanks for teaching us today about this new solution for some anxious families.
Absolutely. Thank you so much for having me. I appreciate it.
You bet.